Welcome back to No More Cavities. Today we will be discussing injuries to primary teeth and different type of injuries from chapter number 13, traumatic injuries to teeth. So the first type of injury is enamel infarction. Enamel infarction. Consider this is a tooth. This is the crown portion, and this is the root portion. So enamel infarction means that there is a crack in the crown. A simple crack, there is no loss of tooth substance. There is simple crack in the crown. This is known as enamel infarction. Then comes enamel fracture. The second type of the tooth injury is enamel fracture. This is a tooth again, and we are discussing enamel fracture. The first was enamel infarction, which means that there is a simple crack in the tooth, and then comes the enamel fracture. The second, enamel fracture, means that there is some loss of the tooth structure. For example, this portion, we consider that there is loss of a tooth substance. And first, there was enamel infarction, which was a simple crack, but there was no loss of the tooth substance. But enamel fracture, there will be some loss of the tooth substance. Then comes enamel and dentine fracture. If we are considering this as an enamel, and if we are considering this as a dentine, this is some portion of dentine, and this is the pulp of the tooth. This is the pulp of the tooth. This is enamel. This is enamel, dentine, and this is the pulp. So, in enamel and dentine fracture, there will be fracture of enamel and there will be fracture of dentine. There will be some loss of enamel, there will be some loss of the dentine, but there will be no loss of the pulp. In enamel infarction, there was simply crack in enamel. In enamel fracture, there was loss of enamel. But in enamel dentine fracture, the second, which is enamel dentine fracture, there will be loss of enamel, there will be loss of dentine, but there will be no loss of pulp. Then the third type of injury is crown fracture. Same way, this is again the crown, means the enamel, and the dentine. And we are discussing crown fracture. So we will be dividing the crown fracture in two types. Crown fracture will be complicated and uncomplicated. First, we have to understand what is difference between complicated and uncomplicated. Complicate means that there is involvement of pulp. Wherever there the word complicated comes along with the fracture, means that there is involvement of the pulp in the fracture. And uncomplicated means that there is no involvement of the pulp. So when we say that there is a complicated fracture, it means that there is fracture of the crown, there is fracture of the dentine, but there is no exposing of the pulp. Fracture of enamel plus dentine without exposing the pulp is counted as the uncomplicated fracture of the crown. But when there is involvement of the pulp, fracture of enamel, dentine, and pulp. Fracture of the enamel, dentine, and pulp means that there is complicated fracture. and when there's only involvement of the enamel and pulp, it is uncomplicated fracture. So the first type of injury was enamel infarction, in which there was a simple crack in the tooth. The second was enamel fracture, which means that there is some loss of the tooth substance in the enamel. The third type of injury was enamel and dentine fracture, which means that there is involvement of the enamel, loss of the tooth substance in enamel, and loss of the tooth substance in dentine. Then the fourth type of injury is the crown fracture, which we are dividing in complicated crown fracture and uncomplicated crown fracture. The complicated means that there is involvement of the pulp, and uncomplicated means that there is no involvement of the pulp. The involvement of the pulp along with the loss of the enamel, dentine, and not exposing the pulp but enamel and dentine are involved, that is uncomplicated fracture. Then comes the crown and root fracture. The crown and root fracture are also divided in complicated and non-complicated. Crown and root fracture. They are also divided in complicated and uncomplicated fractures. The same term, complicated means that there is involvement of the pulp, and uncomplicated means that there is no involvement of the pulp. Then what is the difference? The difference is, in the first we were only involving enamel and dentine along with the exposing or not exposing the pulp. But when we come to the crown and root fracture, then along with enamel, dentine, there will be cementum. Enamel, dentine, and cementum. So now when we are saying that there's crown and root fracture, which is further divided in complicated and uncomplicated, that means that uncomplicated type of fracture means that there's involvement of enamel, dentine, and cementum without exposing the pulp. And complicated type of the fracture means that there is involvement of the enamel, dentine, cementum with exposing pulp. Then the sixth type of injury is root fracture. The root type of the fracture does not involve the crown, it just only involves the root. So this is our whole root. This is our whole root. The root fracture means that there is involvement of the dentine, there is involvement of the pulp, there is involvement of the cementum. There is no involvement of the enamel. And the root fracture is further divided into three types. The first is coronal, middle, and apical. Coronal, middle, and apical. The coronal is also called as gingival fracture. So the root fracture involves dentine, pulp, and cementum. There is no involvement of the enamel. And it is further divided in coronal, middle, and apical. These all are the injuries of the hard tissue. Now we will discuss injuries of the periodontal tissue. So again, we are considering this as our tooth. So the first six were the injuries of the hard tissue, and now these are the injury of periodontal tissue. The first type of injury is concussion. What is concussion? So concussion means that when there is involvement or any injury to the periodontal tissue, there is no displacement, the tooth is not moving, the tooth is not mobile. No displacement and no mobility. No displacement and no mobility but there is sensitivity. The tooth is, when we are applying any type of probe, any type of instrument on the tooth is tender on, sorry, the tooth is tender on percussion. The tooth is sensitive to any type of stimuli. So this type of injury is concussion. What is concussion? When there is no displacement, the tooth is not moving, the tooth is not mobile, but the tooth is tender on percussion. There is injury to the periodontal tissues and the tooth is tender to the percussion. This type of injury is known as concussion. Then the second type of injury. All the periodontal tissue injuries are divided on these three bases, that either there is displacement, there is mobility, or there is tender on percussion. Then the second type of injury is subluxation. Again, the subluxation means that the tooth is mobile, but there is no displacement. The tooth is loose in its socket, but it is not displaced. It is firm in its position. The tooth is loose. When we are applying any kind of pressure, we can feel that the tooth is somehow moving. It is mobile, it is loose, but it's in position, it's in socket, it is not displaced. So this type of the injury is not known as subluxation, and the tooth is also tender on percussion. Obviously it's moving, then it will be tender on percussion. So in concussion, there was no any kind of displacement, there was no any kind of mobility, but the tooth was tender on percussion. In subluxation, the tooth is displaced. The tooth is not displaced, but the tooth is mobile and it is tender on percussion. Now comes the third type of injury. The third type of injury is extrusive luxation. What is extrusive luxation? Extrusive luxation means that there is partial displacement. Partial displacement of the tooth. It means that the tooth is not in its position. The tooth is in socket, but it's not in original position. It is either somehow this is the original position. If there is extrusive luxation, the tooth will be either in this direction, somehow, not fully, but somehow it will be like this. Slight displacement. Let me show you again. If this is the original position, the extrusive luxation will be somehow like this, partial displacement, not in the original position. Okay, so this was the third type of displacement. Now the fourth type of injury, periodontal injury, is lateral luxation. Now what is lateral luxation? Lateral luxation means that there is displacement. But it is in all direction other than axially. It means that it is not moving towards the root, it is not moving inside, it is lateral displacement. If we consider that this is the socket of the tooth and this is the root and this is the crown. This is the crown. So the tooth is not moving axially. It means it is not moving in this direction. It is not moving towards the socket, but it is somehow moving like this, laterally. So this type of displacement of the tooth is known as lateral luxation. Now the other type of the injury is intrusive luxation. Intrusive luxation. Intrusive. And intrusive means that tooth is displaced. The lateral also means that the tooth was displaced, but it was not moving axially. And intrusive, it will move axially. It will move towards inside. So if there is a patient coming to you and there's intrusive luxation, the tooth will not be in occlusion. It will seem as infraocclusion. For example, this is a tooth, normal tooth, again normal tooth, and now it is a intrusive luxation. In this tooth there is intrusive luxation and it is moving inwards. It is moving axially into the alveolar bone, into the socket. So this type of injury will be known as intrusive luxation, moving towards the socket, moving axially towards the inside. So this the intrusive luxation will be not in occlusion, not in line of occlusion. The last periodontal injury is avulsion. Avulsion means that the tooth is out of socket. It is completely out of socket. It is in your hand. So these were different type of injuries with their explanation. Thank you very much for watching.